Hello, everyone. I'm Jessica Blackberg. Welcome. Okay, you guys, polio is circulating in New York City. Yesterday, it was in 4 boroughs or areas. We're going to read this article together because it just broke today. And we're going to see what they're saying. I hope all of you are vaccinated. It doesn't matter if you're not in New York, because remember, when there's a virus out and about, it spreads. We do not see it entering our bodies. But this is very dangerous. It causes paralysis, and that paralysis is usually non-reversible. So make sure that you are not at risk, okay? Anyway, let's get to this article by Forbes. The United States has joined the World Health Organization's list of countries where polio is circulating owing to the spread of vaccine-derived virus in New York. The Centers for Disease Control and Prevention announced Tuesday, making a new low for the country's public health efforts and highlighting the dangerous consequences of the growing anti-vaccine movement. You guys, I know that a lot of these vax are, we're kind of suspicious of them, but most of us, if not all of us, at a certain age, we had to have them to start school, even to go to college. So if you're okay, I'm pretty sure the kids will be okay. I'd rather have some sort of thing happen, except for death, from the jab instead of becoming paralyzed. So I don't know. It's all up to, each person and what you think is right for you and your family. But for me and mine, we all had the jab. We are all up to date. We've had all of our boosters. And I'm not afraid because our parents and grandparents had all of these very same jabs before they were able to go to school. And whenever they say vaccine derived, it's a live vaccine that is usually given by mouth sometimes. And because it's a live vaccine, these people sometimes can develop the actual illness. That is what I read. So back to the article. The U.S. has met the WHO's criteria to be added to the list of countries with circulating vaccine-derived polio virus, the CDC said, which includes Yemen, Somalia, Burkina Faso, Uganda, Ethiopia, Ghana, and Eritrea. It is the only country from the Americas in the list, and alongside the UK and Israel, one of the only wealthy nations to feature. So I think it was about 3 months ago, 2 or 3 months ago, where I read that there were, in the UK, they were finding the same thing in the sewers. The virus was being found in the sewers there. And so far in the United States, there was, at last that I read, there was only one confirmed, and the young man was in his early 20s, and he showed up to a local hospital paralyzed because he had not, if he had any symptoms, he had not gone to the doctor before then. And so every other time that they found the virus, it has been in the sewer, which means that there are people shedding the virus. So, WHO criteria require a country to have detected vaccine-derived polio virus in at least one environmental sample and one patient to be considered a country with circulating virus, the CDC said. Water sampling in New York has identified 57, you guys, 57 confirmed samples of poliovirus since April, And a case of paralytic polio was confirmed in the state's Rockland County in July, comfortably meeting the organization's criteria. No additional cases of polio, the paralytic disease caused by poliovirus, has been reported in the U.S. at this time, and CDC continues to recommend polio vaccination for children and adults. Dr. Jose Romero, director of CDC's National Center for Immunization and Respiratory Diseases, stressed vaccination as the safest and best way to fight this debilitating disease. So, you guys, be careful out there. And this is a quote. It's labeled a crucial quote. We cannot emphasize enough that polio is a dangerous disease for which there is no cure, Romero said. It is imperative that people in these communities who are unvaccinated get up to date on polio vaccination right away. Yes, you wouldn't want to see a loved one, especially a child, and because, mostly kids got it back in the day, your child paralyzed because you decided you didn't want to give them a vaccine that has been proven safe. I mean, just looking in my family, none of us ever had any issues after receiving that. Make up your mind on what you think is necessary and what you think can wait, and get those done. In my opinion, this is necessary. If your child has not been vaccinated, it doesn't matter if they're only reporting it in New York. It's so easy to travel and have this spread across the country. Remember what happened in late 2019? And we're still dealing with that right now. Think about it, you guys. Let me know what you think in the comments.